Thanks, everybody, for coming. With me are Senator Isakson, Congressman Paulsen, and Congressman Welch. And we're each going to make a short statement. Shouldn't take but 90 minutes or so. It won't be long, but no, we're going to be brief. The Medicare program that millions of Americans treasure is now dominated by cancer and diabetes and heart disease and other chronic conditions. And we believe it's time for reform that offers seniors with these health care challenges better quality, more affordable care. Fortunately, we've got with us this morning several pioneering health care leaders that are paving the way for reform now. And the bipartisan legislation that we propose today is designed to remove the government shackles on innovation so that these leaders can become the norm rather than the exception. Now, we'd like to start with a little bit of good news. When the Senate Finance Committee, on which Senator Isakson and I serve, recently approved legislation to fix Medicare's broken system of reimbursing doctors, our bill locked in specific incentives to move away from fee-for-service medicine. To that finance bill, we were able to add the foundation for improving chronic care for seniors, reforms that guarantee many more seniors access to individual care plans that are tailored to their unique needs. So the four of us are here this morning to build on that progress and introduce a bold, fresh approach in Medicare. The idea that chronic care ought to come first. And our bill does that by the following. First, we create better care health practices and plans that empower teams led by nurses, doctors, and physician assistants that adhere to the highest quality standards. These innovators would receive one payment for their collective efforts to meet the chronic health needs of the seniors who are enrolled. This means we're going to give providers the flexibility to deliver the right care at the right time, and that is not done today. Second, because most seniors don't have access to coordinated chronic care, we set aside federal rules. I won't go into all the root canal-like discussion of what those are. There's something called the attribution rule. And in effect, these rules prevent the teams from actively reaching out to the seniors who would benefit most from the kind of specialized chronic care we advocate. Third, our legislation also changes federal law so that participating practices and plans can reward seniors who participate, and this means they would get lower out-of-pocket costs when they work with their health care team. The chronic care bill recognizes also that seniors live all over the country, and a big part of our work is to make sure we bring providers and plans to every nook and cranny of the United States. And for those seniors and providers in rural or underserved areas, the legislation uses telemedicine in some fresh ways to connect seniors, families, and communities who want to monitor and help older people manage their chronic conditions. A word about the private sector. We want to thank all our partners because we know you're making progress. The reason for our legislation is there shouldn't be as many barriers when seniors and providers arrive at the gates of Medicare. Let me wrap up by saying that we're especially proud in Portland, my hometown. I desperately wanted to play for the Portland Trail Blazers, which was a delusional theory because I was too small and I made up for it by being slow. And we're very proud at plans like Kaiser and Providence and others that we have in our community that bring this coordinated care, better care at lower cost. And in Oregon, we want to make sure that all the rest of our state and the rest of the country can have access to that kind of care. I'll close with just two last points. This is really, in our view, what we need to do to change the debate here in Washington, D.C. about Medicare, which, as you know, has not exactly been the ideal drill in bipartisanship in the past. Every day, Americans hear statistics about the impact chronic illness has on families, on productivity, and the economy. But I can tell you, I have not been to a press conference, certainly not one like this, that involves providers and practices and seniors and others, where everybody in the room, Democrats and Republicans, wants to talk about solutions to a big issue that protects Medicare's guarantee, which is what it is for seniors, and does it in a way that's going to contain costs. And the last point is just going to be personal. These are the issues that drove me into public life. 40 years ago, when I had a full head of hair and rugged good looks, I was a staffer to our Senator Wayne Morris. And seniors would come up to him and say, "Wayne, what happens when my benefits get cut off, or I'm caught up in the bureaucracy?" And he'd say, "Ron here is going to look it up for you." And I'd go, "Me? What do we have then?" And back then, we didn't have the network of services that we had. I called up every attorney in town, asked them to volunteer their time helping low-income seniors at senior centers. We organized the Oregon Gray Panthers. And so this is my passion. This is why I went into public life. And I just feel shot in the arm with good luck to have these wonderful partners. And we're going to hear from Senator Isakson, then from Congressman Paulsen, then from Congressman Welch. We'll have softball questions. Our providers are going to be available to take it. If you want to ask anything of us, give my friends here the difficult ones, give me the softballs. But let's all welcome Senator Johnny Isakson.